Hi guys, welcome back to the channel. So last class we have started with cutaneous pemphigoid. Okay, let me make one thing clear that pemphigoid and pemphigus vulgaris are two different lesions. They are not same lesions, okay? Pemphigoid have two type of pemphigoid, cutaneous and mucosal. And we are studying cutaneous pemphigoid. तो cutaneous pemphigoid का हम लोग starting का पढ़े हैं. अब now we'll be starting with clinical presentation and pathogenesis. Okay, let's start. So, it affects both sexes equally, occurs in elderly individual. Patient history may include intermittent episodes of exacerbations and spontaneous remissions. मतलब अचानक से बढ़ जाएगा और अपने आप कम हो जाएगा. After 5 to 6 years, the disease usually subsides into remissions or only mild symptomatology. Okay, या तो एकदम mild symptoms होंगे या एकदम subside हो जाएगा after 5 to 6 years. The pathogenesis of cutaneous pemphigoid involves circulating IgG type antibodies which attack BPAG1 and BPAG2 proteins antigens. तो auto antibodies बनते हैं इनके against. Within the basement membrane, basal cell lamina lucida layer. The antigen antibody complex fixed complement, mainly C3, which initiates the series of steps that lead to inflammation. Inflammatory cells such as neutrophils, eosinophils, and macrophages release proteases such as lysosome, which degrade the basement membrane at the lamina lucida level and generate pain by the formation of bradykinin, kallikrein, and slow reacting substance P. तो in general क्या हो रहा है, कॉम्प्लीमेंट फिक्सेशन हो रहा है और जिसकी वजह से इन्फ्लामेटरी प्रोसेस स्टार्ट हो रहा है, जिसकी वजह से प्रोटीजेज रिलीज़ हो रहे हैं, ब्रैडीकाइनिन सब्सटेंस पी रिलीज़ हो रहा है, जिसकी वजह से इरिदिमा और पेन हो रहा है. तो thus lesions are cutaneous, somewhat painful and erythematous in nature because जो inflammatory process हो रहे हैं that will lead to this ultimately. Okay. Now coming to the differential diagnosis. First differential diagnosis is pemphigus vulgaris. It is also present with skin, vesicles or bullae and oral lesion, but bullae are smaller and not as pruritic. So इनके जो बुले होते हैं pemphigus vulgaris के वो small होते हैं और वो pruritic नहीं होते. Second is the oral vesicles of pemphigus vulgaris are more painful और इनके जो oral vesicles होते हैं वो ज़्यादा painful होते हैं. Now coming to mucosal pemphigoid, skin lesions are not as prominent, only in 20% of cases. तो mucosal pemphigoid में skin lesions कम होंगे और cutaneous pemphigoid में skin lesion ज़्यादा होंगे. तो ऐसे हम लोग differentiate कर सकते हैं. And concomitant conjunctivitis which cutaneous pemphigoid does not have. Okay, तो mucosal pemphigoid में concomitant conjunctivitis भी देखने को मिलेगा. And third differential diagnosis is cutaneous or erosive lichen planus. Okay, now that's all about differential diagnosis. Now coming to diagnostic workup. Biopsy of either oral mucosa or skin lesions in which a vesical edge or normal appearing tissue adjacent to a lesion is sampled. तो biopsy is the diagnostic workup. और वैसे ही जैसे उसमें लेते थे इसमें भी 2 biopsy specimen लेंगे या एक को 2 उसमें डिवाइड कर लेंगे. ओके, 2 biopsy specimen और 1 biopsy specimen separated into 2 equal representative halves should be taken. One is submitted in 10% neutral buffer formalin and other is placed in Michael medium for direct immunofluorescence. We have seen this. Okay. Most cases can be diagnosed with H&E histopath correlated with a distinctive clinical presentation. Direct Immunofluorescence is used to confirm the diagnosis by identifying specific anti-basement membrane zone autoantibodies to BPAG1 and BPAG2. That's all about diagnostic workup. We'll be continuing cutaneous pemphigoid in next class. Till then, like, share, subscribe and comment. Bye.